I'm Dr. Roseanne Schaaf, and I'm on the faculty at Thomas Jefferson University in the Department of Occupational Therapy. And I'm going to talk to you a little bit about children that have sensory integrative dysfunction, and a little bit about the treatment that's available for them, and then some research that we do at the university to help these children. My background, as I said, is an occupational therapist, and I'm also a neuroscientist. I have a PhD in neuroscience. And I became interested early on in helping children that have sensory integrative dysfunction. And so I've worked with these children and studied these children my whole career. And I'm fortunate enough to have a program of research that's funded by the Wallace Research Foundation to examine children with sensory modulation problems and to look at their physiological responses to sensation. I'll tell you a little bit about that later. Sensory processing disorder is also known as sensory integrative dysfunction. Both of those terms are used interchangeably now. And what sensory processing disorder does is it describes a group of children who have difficulty processing and modulating sensory information to the extent that it interferes with their daily routines. So what we see in some children with sensory processing disorders is that they can't tolerate different kinds of touch or tactile input. They might have a limited repertoire of foods. They might have difficulty coordinating their movements, not be aware of where their body is in space, and bump into things frequently. Overall, these difficulties with processing sensory information result in children who have difficulty learning, organizing their routines at home, and playing with others. There's actually 3 different kinds of sensory integrative disorders or sensory processing dysfunction. Children with sensory modulation problems. These are the kids who over or under respond to typical levels of sensation. The second type is children with sensory discrimination disorders, and these are kids who are not able to discriminate the fine qualities of sensation. For example, putting your hand in your pocket and feeling the difference between a quarter and a pen. And then children with dyspraxia or other sensory-based motor disorders. These children have difficulty planning and carrying out fairly simple movement routines like climbing on and off swings or climbing up a sliding board. Typically their posture and muscle tone is decreased so that they might slump in their seats or have difficulty standing upright. And also these children have difficulty sometimes creating ideas for movement and play, so that their play might be delayed. And these are all a sensory basis, all of these disorders I describe, and they all are under the umbrella of a sensory integrative dysfunction or a sensory processing disorder. The most widely utilized treatment for children with these disorders is occupational therapy using a sensory integrative approach. Occupational therapists have been trained to assess, recognize, and develop treatment for children who have difficulty processing, discriminating, and integrating sensory information. Occupational therapists learn in their education how to develop treatment plans for the children, how to work with families, and how to work with schools in school situations to help these children reach their highest level of competence. This is a book by Lucy Miller, Sensational Children, that was specifically written for parents to help them understand sensory processing disorders. You might also want to go to Lucy's website, which is spdnetwork.org, all one word, SPD Network. Myself and my colleagues have written a few books that may be useful for parents, but are really more for professionals. Understanding the Nature of Sensory Integrative Dysfunction with Diverse Populations, which takes the theory of sensory integration and applies it to a variety of populations of children, including children from deprived environments, such as those that are adopted from European orphanages, and also children with autism, Fragile X, visual impairment, etc. So they're just some of the many resources that are available for parents. As I said, my background is neuroscience, and I was very interested in looking at what is causing children to over or under respond to sensory input. And so we focused our studies on children with sensory modulation problems, and we are measuring what happens in the autonomic nervous system. That's a branch of our nervous system that helps us protect or fight or flight when there is a scary or a loud stimulus, and our parasympathetic nervous system, which helps us relax and stay in what we call homeostasis. We hypothesize that these kids with sensory modulation problems have an imbalance in their autonomic nervous system, and so they're going into fight or flight very readily, and they're not using their parasympathetic system to help modulate and calm them. So we study this in a very interesting laboratory that's called the Sensory Challenge Protocol. Our laboratory is set up to look like a spaceship, so the kids get the impression that they're going off into space. In fact, they even watch a short video clip of an astronaut getting hooked up to go to space, while we put 3 small cardiac leads on their chest and 2 small electrodermal leads on their hands. And then we proceed to expose the child to various sensory stimuli in all different senses. For example, one of the sensory stimuli is a feather being placed across the chin. Another of the sensory stimuli is the chair that they sit in tilts back, so we look at the vestibular stimuli. We collect data on the children's behavioral responses to sensation from the parent, their adaptive behavior, how they manage their everyday life, and their physiology, their autonomic nervous system activity during these sensory stimuli. And we're looking to see if we can find some themes in their physiology and their behavior that will help us guide intervention. So if we find, for example, that the children are having difficulty regulating their response to sensation because their parasympathetic nervous system isn't working well, we can develop interventions for occupational therapists to use to help children stay more regulated in environments where there's going to be stimuli that may cause them to have an over-response. So we are always looking for children between the ages of 5 and 12 who have sensory modulation problems, and we are also looking for typical children to be the controls for the study. And we would very much appreciate anyone who's interested in participating in the study to call our research lab. The information for that is also on the website. And also, we are looking at children with autism. That's a separate study, but if there are any of you out there who have children with autism, we would be happy to have them come as well. We provide the parents with a parking voucher, and we provide the child with a small toy. There's one other thing I want. We provide the parents with a short summary of our findings from the behavioral testing that we did. And we can tell them a little bit about what we see with the physiology when we look at the computer screen with them.